Hello and welcome back to the Stay Sure Wellbeing YouTube channel. I'm Dr Dawn Harper, and today I thought we'd talk about the new rules on face coverings and face masks. Things are changing rapidly and they're not the same between the four nations of the UK, so definitely worth checking any updates for where you live. But in England on the 24th of July, it is already mandatory to wear face coverings on public transport, but it will also become essential that you are wearing a face covering when you're out in shops and supermarkets. That's already the case in Northern Ireland and Scotland, and Wales will be following suit with insisting on face coverings on public transport on the 27th of July. There are some exceptions, so we don't recommend that very small children below 2 or 3 wear face coverings, and that's simply because their airways are so tiny that they do have an increased risk of suffocation, and at that tiny age they wouldn't necessarily be able to have the coordination to remove the covering should they get into any kind of distress. Other than that, the transport rules, for example, do vary. So in Scotland, children under 5 are exempt, whereas in England it's under 11. So again, worth checking. And if you have a medical condition, which means that you may struggle to either remove a mask or you have a respiratory problem, for example, then you may be exempt, but you may be required to provide a letter from your doctor confirming that this is the case, and there may actually be a fee for that letter, so certainly worth having the conversation with your practice and finding out what the state of play is. So what are the differences between all these different coverings and masks? A face covering can be made out of fabric, it can be homemade, it must cover your nose and mouth, and it is usually either fixed with little hoops behind your ears or a tie at the back of your head. Now the thinking is that this is designed to protect others from you should you unwittingly be shedding the virus. We know that people who are incubating the virus might be shedding that virus for a couple of days before they develop symptoms, and increasingly we are learning that some people have the virus with no symptoms at all. So just because you feel well doesn't mean that you may not be putting other people at risk, and that's the reason why the rules are changing. It's also because as lockdown is being eased, more of us are out and about, and it is therefore in some instances less easy to adhere to the 2 metre social distancing. Now the rules have gone down from 2 metres to 1 metre plus, but I would actually recommend that wherever possible you stick to that 2 metre social distancing. And the reason is this: your risk of contracting coronavirus from somebody who is shedding that virus at 1 metre plus is 10 times that of if you were in that person's company at 2 metres. So wherever possible, now is a time to be, if anything, more fastidious about the 2 metre social distancing, and of course about hand washing. If you're wearing a face covering, make sure that you keep it on at all times when you're out, that you change it every 4 hours, because the moisture from your breath will make it less effective over a period of time. And when you store it, keep it clean. So if you're using them as disposable coverings, then all well and good, but most homemade face coverings you will be washing, so you're probably going to need more than 1 or 2 so that you've always got them at hand, and keep them in a clean place. This isn't something that you're kind of going to pop at the bottom of a pocket or the bottom of a handbag. Keep them clean and on hand at all times. Face masks are different. A face mask is classed as a medical device and needs to adhere to certain medical standards in order to obtain its CE mark. And face masks can be of 2 types. They can be disposable, so they're a once use. Those are the paper type masks that you'll see used in clinical settings quite a lot, and those need to be disposed of after every use. Or they can be washable. And again, they need to be regularly washed, and you need to check the guidelines as to how often they can be washed before they may not be as effective. Then there are face shields. Those are the plastic visors that you will have seen people wearing in clinical settings and on various news bulletins. And those again are medical devices with a CE mark that are designed to protect the wearer from exposure to the virus and also other people from the wearer. And finally, there are the respiratory masks. These are the sort of class 3 PPE that are reserved for high risk situations. They are very highly technical masks that are designed to be used when we are, for example, performing aerolizing procedures, something like intubating somebody in an emergency setting. And when I'm out and about, I wear a face mask that adheres to a CE mark, so I know that I'm getting some protection myself. It's a fabric mask that I can wash up to 50 times before I need to replace it. So that's what I wear, and I hope that's been useful. One little quirky question that I have had is, I know some people who wear glasses have found wearing face coverings and face masks quite difficult because their glasses tend to steam up. And in that scenario, you might find it easier to wear a fabric covering or mask, which seems to cause less steaming. It may be that perhaps you need to consider contact lenses, because it is a real issue for some people. But as I say, the fabric coverings do seem to be better tolerated. So I hope that helps. I hope that's been useful for you. As always, please do let me know if there are subjects that you want me to cover. You can do that either by messaging us here, or you can email me anonymously. We really want this resource to be useful for you. So do let me know any medical topics you want covered, and I will try to do that for you. But until next time, stay safe and stay well.